Thank you very much, Tracy. Okay, in 2009, in a legal case, a jury returned a verdict that Paxil had caused birth defects. This cost GSK over $1 billion. Now, any drug that causes birth defects will cause autistic spectrum disorder also, ASD. So this led me and colleagues to begin to put together an article on links between SSRIs and ASD, and there was loads of evidence 10 years ago or more for this. Plus, in addition, we found that mothers who are taking SSRIs during pregnancy have a 10-fold greater risk of having a baby with fetal alcohol syndrome. And the Canadian guidelines for SSRIs now say SSRIs cause alcohol use disorder. So the labels of SSRIs, however, don't say this. Since the jury verdict 15, 16 years ago, 5 times more women take SSRIs in pregnancy than took them back then. And of course, you'll know that if you aren't suited to the SSRI, you're likely to be put on an anticonvulsant, and there's a 10-fold greater risk that you're going to be put on an anticonvulsant now than before the jury verdict back then. And your baby is going to have fetal anticonvulsant syndrome, which again is another word for ASD. We've known, as you've heard from Adam, for 25 years, the animal literature points to the fact that pregnant animals have offspring who essentially have ASD. This research also tells us how this is happening. You've all seen high-rise buildings being built where they put metal girders in the ground and essentially hang the building off these huge metal girders. Well, the sensory system is the set of girders that supports brain development. If you give a drug that mutes sensory input, as SSRIs do, this is their core action, you're going to weaken those girders. The other drug that mutes sensory input and acts on the serotonin system is acetaminophen, APAP, which leads to an increased rate of ASD in animals who have been exposed to it during pregnancy, well, in their offspring, and also in humans. And you've heard from Jay that some of the best studies we've had done recently show the fact that in humans, mothers, where it was expected their depressive behavior would affect their children, it turns out, in fact, when they're taking an antidepressant during pregnancy, this has a much bigger effect on their daughters in particular that shows up at puberty when daughters develop nervous problems. Okay, so it'll come as no surprise to anyone here that middle-aged women in Australia take more antidepressants than men. What will be a surprise, perhaps, is the group who are starting on these drugs the most now are women between the ages of 15 to 30. This is the group of people who have black box warnings for these drugs. And the warnings have clearly become may contain nuts labels. What you need to appreciate about the warnings for minors is that it wasn't because younger people had a greater risk of going on to become suicidal than adults. It was because only 49% of youngsters could show a benefit on these drugs, and FDA felt they had to warn in those circumstances. In the adult trials, it's only 51% of people or so which show a benefit, and FDA have used that to justify not warning at all. So there's the effect of what RCTs show, the averaging effect of RCTs. That's playing a big part in the problems we have. Let me take you into a courtroom, and you're a jury, and you're asked to decide, did this man murder his wife? And his lawyer says to you, well, the best science we've done shows that men, even with a criminal record, and legal difficulties, and financial difficulties, and wives that nobody likes, on average, these men don't murder their wives. So you cannot find him guilty. You'd say, that's nuts. We're going on the basis of the case in front of us. That's what doctors used to do but can't do any more. Patients in mental health wards can do better than mental health kind of staff. They can see a doctor go on an SSRI and can see if the effect on him is good or bad. Families can do better than mental health staff. Prisoners in prisons can do better looking at inmates than mental health staff. The people who can't spot what the drugs are doing these days are mental health staff, those of us like me who prescribe the drugs, and therapists like Jeff who do therapy rather than give pills. And this is odd because we've got the SSRIs, because Freudian therapists 30 or 40 years ago could spot what the older drugs were doing, and that's what led to us getting the SSRIs. So we've got RCTs, which we have in the wake of the thalidomide crisis, which also put paperwork in place to keep the first half of pregnancy safe. Because we're now doing RSV trials during pregnancy, FDA and other regulators have realized they need to have paperwork for the second half of pregnancy, the bit that's key for ASD development. Now, that's going to be guidance for industry, and the drafts that are out there are full of industry buzzwords. It's not guidance for doctors. What FDA are doing is the same as what FAA do when Boeing send them in paperwork. It's pilots that keep you safe when you get on planes. Doctors used to do this, but they don't now. They defer to the label of the pill. And if you're on a healthcare flight and someone says the door is just blown off this plane, nobody listens. In fact, you're liable to be thrown out the open door because you're spreading misinformation. In his Face the Nation interview in June, Marty McCarry said, "We've got to let doctors be doctors." My point is we've got to get doctors to be doctors again, make doctors great again. Or we can opt to say, well, you can just dispense drugs. You don't have to try the facts of what's actually happening to the patient right in front of you. But if we can't save lives, we can at least save money by paying doctors the rates we pay nurses and pharmacists, which is what's happening increasingly. Thank you.